Happy Wednesday, everyone, from Empowered Families Chiropractic. So today I want to talk about hormones. One of the questions that is on my initial intake paperwork is for, we have two different sections, female and male, but especially for female, we ask a lot about the menstrual cycle and just general things that go along with hormones. So, and most people just fill it out and don't even question it, but other people do ask, why do you need to know about my menstrual cycle to help my back pain, right? So I wanted to discuss that with you all today. So hormones are so important. We know we need to have balanced hormones so we can do pretty much everything. And it's not just when you think of a menstrual cycle. Yes, female hormones are super important. We want to make sure that we have a regular menstrual cycle, an average amount of time. We want to make sure it's within a certain time frame. We want to make sure that we're ovulating and we're having hormonal shifts from the estrogen to the progesterone, and that's super important. But there's so many more hormones that people don't think about. So the stress hormone, cortisol, there's a bunch of other ones. Hormones actually affect our digestion. Hormones affect our sleep. Pretty much every single thing in our body is controlled by a hormone or stimulated by a hormone. So, and when we bring that all together, chiropractic is about overall function. And how hormones operate is through our nervous system. And again, chiropractic is all about the nervous system. We make sure that the brain and body are communicating so that the nervous system can function at its optimal levels, so that when you're functioning at your optimal levels, pretty much everything improves. But one of those key things that improves is our hormone function. So a lot of times when females come in, if they aren't having a regular cycle, or in some instances when females are trying to get pregnant and they're tracking their ovulation, they'll notice that they're not ovulating every month, or they're not ovulating with a big enough shift to the progesterone side, because we know that we need a shift from estrogen to progesterone to have a viable pregnancy. So, however, if you're not tracking, most people just go by the time between their menstrual cycles. And so a lot of times when people come in and I ask and we keep track of what's going on, they see improvements and normalization in their menstrual cycles, and also too with fertility. They notice that they do have the big enough shift between the estrogen to the progesterone, which I guess I should probably do a whole video on the female hormone cycle, because this might be if you've never heard it before, this might be a little confusing and you might not know what I'm talking about. So I'll do an entire video on just female hormones and how that works. But just overall, remember, chiropractic is all about function, how you're functioning, and making sure that you're having that you're thriving, that you're having those highest levels of function. So if you have any questions on particular hormones or anything like that, I would love to have a conversation with you about that. I also I'm going to do a few more videos on specific hormones as well, but I just kind of wanted to introduce the topic of just hormones and how chiropractic relates to hormone function. So if you have any questions at all, please feel free to contact us by messaging us on any of the social media platforms. You can give us a call at 224-478-2621, or you can shoot us an email at hello@empoweredfamilieschiro.com. And I hope you have a wonderful rest of your day.